Michaela Nunley. I'm 15 years old, and I have hereditary pancreatitis. I was first diagnosed with this when I was 3 years old, and I've been going to the hospital ever since. It's not something that just goes away, sadly. So, up until I was 10, I was in and out of the hospital about every year, and I have been going in and out of the hospital every year since I was about 3 years old. But just let me tell you about a regular flare-up. Now, a regular flare-up, what happens is your stomach really hurts, and it's just bad. So, I would come in to the doctor's office, they would draw my labs and check my amylase and lipase, and if they were high, I would get admitted. When I got admitted, I would get a room, and they would put me on IV fluids, and I would get an IV, obviously, and I would get morphine for my pain. Now, I would be NPO, so I couldn't eat or drink anything until my amylase and lipase levels went down. When those went down and I wasn't having as much pain, I could start drinking clear liquids, and the next day I'd have full liquids if everything was going good, and then if everything was going good, that day I could start eating on a low-fat diet. And a low-fat diet, if you're on it, you would know it's not all that great. Gotta power through because you gotta eat. So then after that, I would be able to go home, and that happened for about 10 years. And then, when I was 10, in 2008, what happened was we went in and I had a pseudocyst on my pancreas. So I came in and they admitted me once they found it after a CT scan. I came in and they gave me a PICC line. Now a PICC line is like this, because this is a PICC line, and you have a tube going up into your arm and, yeah, into your heart. Well, not into your heart, but into a vein connected to your heart. So, through the PICC line, they gave me TPN and lipids. And that was how I ate, and that was my food. It's not really food. Plus, TPN and lipids taste really, really bad, along with saline. So, a helpful hint to do with that is like pop in like a Jolly Rancher or some gum, if you're allowed to. And it makes the taste in your mouth the taste go away, and you just have that yummy taste from whatever you're chewing or sucking on. Oh, so then I had my first operation, because after a while on the TPN and liquids, they were like, okay, well, this isn't working. Making no food in your stomach. I mean, because with the TPN, nothing goes towards your stomach. It's all in your veins, and that's how they're feeding you. So, then I came in, and they put me under anesthesia, and with the anesthesia, after I was knocked out, anesthesia is a good thing, so don't be scared of it. So, after that, they put a needle in my stomach, and the scar's like that big. Okay, I read it my first that big. And they drew out all the liquid that was in my cyst, and it was about as much liquid as you get in a can of pop. So, after about a day, my cyst came back. It was all filled back up with all that liquid. So I went on TPN for a little bit while longer until they decided that I had to have a cystogastrotomy. So, once again, they knocked me out with the anesthesia, which is a good thing, and because you don't feel anything while you're asleep. Which is great. Yeah. I have 4 scars on my stomach, and with those 4 scars on my stomach, they put a stent directing my, they redirected the path that all my chewed up food was going on, steered it away so it wouldn't secrete fluids onto my stomach and cause me as much pain, and it would also drain the cyst. So, after that, I woke up and I also had an NG tube. Now, most of you that have NG tubes, I bet they're great. But the one I had didn't really work out. Now, if you're getting one, I bet it's going to be great, so don't worry about it. But this is just my story and what happened. So, the NG tube, for all of you that don't know, they go up your nose and down your throat and into your stomach. Now, mine got tangled up. So it didn't work, and the suction didn't work. So the NG tube got all tangled up in my stomach. So what they had to do is they had to pull it. Now, what they did is they pulled it out of my nose. Now, getting anything pulled out of your body that's really long feels absolutely weird. Like getting your PICC line pulled, which had that pulled too. And what they did is they just yank it out, and it feels really weird because like the slimy thing just crawling down your arm. So, I mean, you don't have to worry about it because it doesn't hurt. It just feels really weird. So they did that, and they pulled my NG tube, and I was vomiting because the tube wasn't working, and before that I was vomiting too because this was like a 2-day process. So once I pulled it out, I felt great, and everything was all good, and I went back home. And then I was good for about 2 years until I had another flare-up. And that was okay. It was just like a regular flare-up, just like I described to you. And then about a month and a half ago, I was having trouble breathing. And so we went to the doctor, and the doctor's like, oh, you have allergies. So I took my allergy medication, and it wasn't working. So we went back, and I got a chest x-ray, and it turned out that my right lung was full of fluid. So they rushed me here in an ambulance, and while I was in the yard, they gave me a chest tube, and it drained out all the fluid that was in my lung. And after they did that, they did about 3 more of those, just changing the tube out. Which, I mean, chest tubes, they hurt, but it's not bad because they're going to give you pain medication, so you don't got to worry about it. It's going to be all good. Plus, you're getting better. And PICC lines don't hurt either. So, I mean, it's all good. I mean, everybody's just working for you to get better. So be happy. Keep your hopes up. And if you're watching this and you're not in the hospital, good for you. Stay well. Now, it's really important for you to talk to your doctors. I was having trouble talking to my doctors, which is not a good thing. Now, you have to talk to your doctors. I can't stress that enough to you. You got to talk to them, or they really don't know how to help you. Now, for example, I was having trouble talking to my doctor because I was really mad, and I didn't feel like talking to them. And so, eventually, she just forced this PCA pump on me because she didn't know what else to do. And I just told her I didn't like it, and you have to talk to them. You got to tell them the reason why, or they won't be able to help you. Well, have a good life. Hopefully I'll see you again. And have a great day. Bye. CT scans, they're really weird because they put fluid on you, and it makes you feel all warm, but it also makes you feel like you have to pee. So don't worry about it.